My name is Troy Lanigan. I'm president of the Canada Strong and Free Network. I want to welcome you all to this special exchange call. We had discussed COVID in April, and since then we've received a number of requests to do a deeper dive. So I'm pleased that we're able to accommodate this this afternoon for some of us, me on the West Coast in British Columbia, this evening for those of you in Ontario and points east. First and foremost, we could not do this without sponsorship, so a very special thank you to our sponsor, Modern Miracle Network. Thank you also to our outstanding panelists who we'll get to shortly. Shalini Seth was scheduled to join us as a panelist, but had a personal issue earlier today that prevents her from joining us. She's fine as I understand, and we trust she's in good hands. Shalini, who runs a manufacturing plant in Ontario, is also with the Coalition of Concerned Manufacturers and Businesses of Canada. So kindly taking her place is Jocelyn Bamford from that organization, and Jocelyn also serves, I should thank her, on the board of the Canada Strong and Free Network. So thank you for joining us in short notice, Jocelyn. A couple of quick housekeeping matters. First of all, we are not going to run the chat function tonight. It's the exception, not the rule, that we don't run the chat, but a large part of today's call is a presentation that we don't want distracted or disrupted. And also, frankly, I received a lot of negative feedback about the April call and a lot of the comments that were posted. So I think we're just going to leave it off on this subject for tonight, and we'll certainly get it back on in future calls. We will, however, have our Q&A box open, which is at the bottom of the screen. Our moderator, Danielle, will have a look in that, but I should say before we got on this afternoon, we had a lot of questions come in, and Danielle's had a chance to look through some of that. Second, if you have suggestions on future topics, please connect through our website or email me directly at troy@canadastrongandfree.network. We have a really solid lineup of speakers for our June call next week. We're going to do it early in June. Big government, free speech, and tinfoil hats, a discussion on Bill C-10. I'll ask Zoe to put that link into the side right now. We're also looking at the issue of housing affordability coming up in July. So if any of you listening have suggestions about speakers or how we might tackle that, happy to hear from you as well. Third, we traditionally run these calls at noon Eastern, but we've had a number of requests that have said, why don't we try running them a little bit later? So we're going 7 hours later than we normally do these. So we're going to try doing a poll tonight. We've got this feature on Zoom. We've actually never used it. You can click on the poll box below and vote for your preferred time. And we'll probably run this for the next couple of sessions and see what the preference is of folks that are listening. Finally, this Zoom call will be recorded and posted on our website and YouTube page tomorrow morning. Now, before I turn it over to Danielle Smith, Colin Craig is president of secondstreet.org, a new think tank. I encourage everybody to check it out if you haven't, secondstreet.org. Colin coordinated 4 other movement organizations along with our friend Anthony Fury over at the Toronto Sun to produce an ebook titled Life After COVID, What's Next for Canada? All of you on the call today are welcome to a free copy of the ebook. And I'm going to hand it over to Colin, who's going to give us a very quick introduction, and then we'll get started with our program.
Well, thanks, Troy, for the chance to give a plug out to the book. I think a lot of people that are tuning into this webinar tonight follow public policy. You know that our country is going to be facing a lot of challenges once we get the pandemic under control. And that's what the ebook really does. As Troy mentioned, we partnered with 4 other organizations to talk about some of those issues and also put forward solutions. So, for example, the Canadian Taxpayers Federation looks at the government debt situation. We just passed $1 trillion in debt, deficits galore across the country. So what their chapter does is they look at how we can get spending under control. The Montreal Economic Institute looks at our healthcare situation. A lot of people know it wasn't in good shape before COVID. It's worse now because we've had hundreds of thousands of surgeries and procedures postponed. They put forward some very good ideas on how we can start to improve healthcare for patients in this country. Our own chapter, secondstreet.org, what we look at is Canada's high unemployment rate, things that we can do to create jobs without government spending money. So there's all kinds of different ways governments can actually create jobs without spending a dime of your money. That's what we look at. The Canadian Constitution Foundation looks at what happened during the pandemic in terms of how our charter rights were infringed upon and what we could be looking at doing differently next time in the event that there's some kind of other emergency. The Justice Center for Constitutional Freedoms looks at how government sidestepped many of our democratic processes. And Anthony Fury from The Sun, he looks at the original emergency plans and how those compared with what governments actually did. So that's a very short snapshot about the book. I understand Zoe's going to share a link to it, and it's available on all the organization's websites that I mentioned.
Okay, well, thank you very much for that, Colin. It's a great initiative. I hope everyone listening tonight checks that out. Okay, with that, I'm going to turn it over for the next hour and change to our moderator, Danielle Smith, a frequent guest to moderate these sessions. Thank you so much for doing it all the time, Danielle. Is president of the Alberta Enterprise Group, but also speaks and writes and moderates on many topics, and very much a friend to the conservative and libertarian and free market movement in this country. And with that, Danielle, turning it over to you for our discussion tonight.
My pleasure. Thank you so much for having me on again. I've had the great pleasure of interviewing all four actually of our panelists this evening, although not all at once. We've got a lot of information that we want to get to and getting to a fear-free COVID recovery. As we were planning this session, we were talking about when governments would start dramatically lifting some of the restrictions. And you may have seen in Alberta today that Jason Kenney, the premier, announced probably the most aggressive plan to reduce restrictions that start on June the 1st, and will have all of the restrictions removed if we meet certain vaccination targets by June the 28th, as early as before Canada Day. So what does that mean for the rest of the country? I think it puts it into an interesting context about whether we're now going to see a race to reduce restrictions, because everybody seemed to be in a race to increase lockdowns. And I guess this is going to be the question, is where do we go from here? Does this mean that it is the end of the line? Will we never see this kind of approach again? Or because we have politicians that are convinced by computer modeling and the efficacy of lockdowns, when we get into respiratory virus season in the fall, which we know happens every single year, starting at the end of October, beginning of November, are they just going to think that they can keep on doing this to us again? Are we going to have our charter freedoms taken away permanently or compromised permanently? So we've got all kinds of ways to approach this issue from various perspectives. We are going to start off with a panel with a presentation actually with Lieutenant Colonel David Redman, who you have seen many times before. He used to advise the government in the position of emergency management boss back in the 2000s in Alberta, and Dr. Ari Joffe, who is he specializes as a physician in pediatrics, pediatric infectious diseases, and pediatric critical care in medicine. He's a clinical professor of pediatrics at the University of Alberta. Then we will hear from Jocelyn Bamford, and she's going to give us the business perspective. Jocelyn, of course, is the president and CEO of the Coalition of Concerned Manufacturers and Businesses. And we will hear from Lisa Bildy. She has got a full plate of a variety of different constitutional and legal challenges to the lockdown measures through the Justice Center for Constitutional Freedoms. And we will get to your questions. So continue bringing them in. I already see that we've got 5 questions lined up. We've got questions from earlier today. But without further ado, I'm going to put it over to David Redman and Dr. Ari Joffe to go through their presentation about how it is we got to this situation where the use of fear convinced the entire population that lockdowns was the right approach. And how do we get out of this? Lieutenant Colonel David Redman, you can start us off.
Thanks very much, Danielle. So folks, just bear with me for just a sec. I'll share my screen, and we're going to run you through a very short presentation between both Dr. Joffe and myself, and just try and give you some things to think about as we go through the discussion tonight. We need to get out of the response that we've done, and we need to get our country back to normal. And by normal, I don't mean new normal, I mean normal. So we're going to go through 3 large overarching topic areas. First of all, case counts, including variants of concern, are the wrong metric to measure pandemic severity and response. And we'll talk about each of the sub-bullets. The second one, lockdowns are based on 3 completely false assumptions, and they should end. And number 3, we must remove fear. if we're going to start a recovery from this pandemic. So without further ado, we're just going to go right into it, and we're going to work our way through each of those bullets. I'm going to start off with the focus on those, the variance of concern is the wrong metric. And the focus on those at high risk outcomes, 60 to 69, and those over 70 should have been our primary focus. Now, we knew this right from the start. This is the data that was available last March. In fact, data was available starting by the middle of February, and it was very detailed and very clear. We knew back a year ago, March, that 95% of the deaths that were happening worldwide were in fact in seniors over the age of 60, and most with severe comorbidities. You can see them listed on the side there. Secondly, we knew that because of that, we should have been targeting the aid directly to those people and not the whole population. Here's the stats from Canada as of May 14th. And so if you look at the graph on the bottom, and this is Health Canada's own data, we know that 95%, that's 24,000, out of the 24,000 deaths, 23,000 of them were in our seniors. And yet we did very little to protect our long-term care homes. In fact, 73% of the deaths in Canada have been in those long-term care homes. That's over 17,000 of those deaths. But more importantly, look at the age group up to age 50. Total for Canada, if you look down there, it's about 400 people total. We lose more people, 5 times as many to car accidents between the age of 20 and 40, car fatalities in Canada every single year than we've lost from COVID. So using the metric of case count is simply the wrong metric. We knew who was at risk, and we should have targeted our support. Harry?
Thank you. This is just a table to give some more detail on the who is actually at risk. And what I've done in this table is shown by age what the infection fatality rate is from the SARS coronavirus 2 virus. And so a couple of points to point out here. One is that we hear the case fatality rate every time we hear the medical officer of health and premier talk about this. But there are at least 10 times more infections than detected cases. And this table shows the infection fatality rate that has led to so much fear. In people 70 years and under, the median infection fatality rate is 0.05%. That means 99.95% of infected people at age 70 and under will survive. And you can see that the infection fatality rate goes up progressively with age, but there's really an inflection point around 65 to 75, around 70 years old, where the infection fatality rate goes up to relatively high numbers. And this is showing you different review articles that have summarized studies from many places around the world. In the table, I put the infection fatality rate for influenza in the US in 2018-19. And you can see that in the 20 to 49 year age group, so under 50 years old, the infection fatality rate is 0.016%. So I'll come back to that on the next slide. Here I put the case, hospitalization in ICU, and fatality rate for the virus in Canada. And remember, these are case rates, so infection rates will be about 10 times lower. What I'm showing there is that the infection fatality rate in age 20 to 49 is actually less than 0.013%, so lower than the annual infection fatality rate from seasonal influenza in people under 50. And even the case ICU rate, all those numbers are in percent, are quite low. And the infection ICU admission rate will be about 10 times lower. So for example, a 40 to 49-year-old has in Canada and Alberta a 0.6% chance of being admitted to ICU, which means less than a 0.1% chance if they get infected with the virus, remembering the difference between case and infection rates. And I'm also showing you the case fatality rate in Canada, March 2nd and May 14th. So even though the variants of concern numbers and proportion of cases have drastically been rising, the case fatality rate has been going down, and the infection fatality rate, remember, at each of these ages will be at least 5 to 10 times lower.
So clearly from the data you're seeing, using case count is nothing other than a tool to create fear, because in fact, the people who are most at risk weren't protected, while most of us who are not at risk were being used a tool of fear to stop us. So let's then talk about the second bullet under why we shouldn't use variants, the case counts. We should have been focusing on surge capacity if we actually felt that the numbers in hospital were going to surge. And the focus on case count told us we were responsible for the fact that the hospitals were going to be overwhelmed, when in fact, the hospitals themselves could have been far better prepared by using surge capacity for peak periods. Now, we always know that hospitals during the winter season have many, many patients in them. But let's use some real numbers. In Ontario, in the middle of the second wave, on the worst day, there was 2,000 people in hospital. But what you weren't told was that there's 20,358 acute care beds in the Ontario system. Denominators were intentionally left out. But if we actually felt that 2,000 was going to overwhelm the hospitals, we should have devoted time and energy a year ago, March, to build surge capacity. And this is how you do it, shown on this slide. We do it in every emergency, and we do it for surge capacity across all of our critical infrastructure, not just hospital systems. Harry?
Thanks. This is to show that surge capacity in hospitals should be building capacity to take care of patients with the SARS coronavirus 2 and all the other healthcare needs in the population. And instead, it seemed that the medical officer of health and government thought that surge capacity meant shutting down everything except caring for COVID patients. And that's not surge capacity. What that did is disrupted healthcare. And here's some examples of what has resulted from that even early in the pandemic. There's a reduction in emergency room visits for heart attack and stroke. So patients didn't come and present later and cannot be given the early treatment that would prevent severe outcomes. More than 40% reduction in cancer diagnoses in Ontario, and hundreds of thousands of CTs and MRIs put on hold in Ontario that screen for cancer diagnoses. Non-cancer surgeries have been put on hold, and early in the pandemic, it was estimated that just in Ontario, the surgery backlog was 148,000 patients and would take 84 weeks to clear once healthcare opened up. Wait times have increased, and an estimate is that it will cost $1.3 billion in additional funding to get rid of the wait times for 6 major procedures. And because of all this, the excess deaths in the year 2020 during the COVID pandemic were not all due to COVID. 20 to 50% in high income countries were due to illnesses that were not COVID and likely related to this disrupted healthcare.
So let's go to bullet number 2. Lockdowns are based on 3 false assumptions. The false assumption that lockdowns are highly effective, the false assumption that lockdowns have a favorable cost-benefit analysis, and the false assumption that lockdowns were the only available response. And you constantly hear all three of those. So let's start with the fact that they're highly effective in reducing the spread of SARS-CoV-2. Prior to the pandemic, back in the fall, September of 2019, the document that you see on the left was produced by the World Health Organization by the best infectious disease doctors in the world. It was specifically targeted at providing the world's best lessons learned and information with respect to 15 or what are called non-pharmaceutical measures. Today, you call them lockdowns. So what you see on the slide is all the 15 listed. You see the top three shown in green, then you see the orange, and then you see the red. The non-pharmaceutical interventions were specifically researched and best recommendations were given, and they were given by severity of pandemic. The top three for a pandemic of this severity were encouraged for use: hand hygiene, respiratory etiquette, and isolation of sick individuals. The ones shown in orange were marginally and possibly recommended depending on certain circumstances that could emerge through the pandemic. So things like surface and object cleaning, and you've heard all the debate around that, masks, avoiding crowding, and travel advice. They were recommended, but in certain cases. The ones shown in red were not recommended for a pandemic of this type. Contact tracing, quarantine of exposed individuals. In other words, sending complete classrooms of children home in cohorts if one member of the class had a member of their family who tested positive for COVID. Not recommended. And the reasons why were listed in this 60-page document. Workplace measures and closures, not recommended except as a last resort in extreme pandemics. Both school measures and lockdown of business were last resort measures in extreme pandemics, and yet we used them last March as our first and only method of trying to control a pandemic. Even things like border closures. So they were found to be largely ineffective after the first 3 weeks of trying to slow the pandemic or to slow the spread of the disease, but it was known, and it's right in that report, that they caused significant collateral damage, some of which you've already been presented by Dr. Joffe, and you'll see more in a minute. So why did we have to relearn this lesson? Because we've learned exactly the same lesson all over again. This is a study written by 5 of the best infectious disease doctors in the world after the first wave, and they compared lockdown to non-lockdown countries. And yes, there's a lot of not lockdown countries in the world. You can, at the bottom of the square box, you can go get a copy of this report yourself. You can see the conclusion. We do not find significant benefits on case growth. The whole reason we're doing lockdowns is to slow case growth. If you look at the box on the bottom, we're going to run through some of this, but that link at the bottom collected 35 of the best peer-reviewed studies done worldwide comparing lockdown to not lockdown in this pandemic. And we unfortunately relearned exactly what we knew in September 2019, that they are lockdowns, non-pharmaceutical interventions should only be used in specific types of pandemic, that they have little effect, not significant effect on case growth or on death. Harry?
What I'm going to show you here are some busy tables that I'm not going to go through the details, but what some of this is showing is that it's not just one study. There are many studies. I put together here all of the best studies that I've seen that show that lockdowns, if they have any effect on transmission of SARS coronavirus 2, it has been very highly exaggerated. And most of them do not find any convincing effect. So how can that be? The problem is that lockdowns are associated with decrease in cases, but that is not a causal relationship. Lockdowns are put in place usually even after the peak of cases, and they are not what is responsible for cases coming down. In these studies, they control for other confounding variables, such as the age structure of a population and population density and other differences between countries, states, and provinces. And they find that lockdowns does not predict decrease in cases. And what I circled in these is that these are studies that compare among many countries. You see 149, 10, 160, 87, 196 countries that compare the stringency of their lockdown to how many cases and deaths they have per million population, and there is no relationship in almost all of the studies, and in a few the relationship is there, but very small. That's why I say at best, the efficacy of lockdowns has been highly exaggerated. And all these, the table is there so people can look at more details in their own time.
Going back to the slide before, at the bottom, all 35 of the best studies are on that link, the AEIR link at the bottom of the slide that led into those 4 pages. And those studies that you see listed on those pages are included in those 35. Over to you, Eric.
So now,
cost-benefit analysis.
Yes, thank you. Talk about the cost-benefit analysis. And to do that, we have to know the effects of COVID, but also the effects of the collateral damage from our response to COVID. And unfortunately, in the press, it's often, these collateral damage effects are often called effects of the pandemic, but I think a more accurate description is that they're the effects of our misguided response to the pandemic. And to look at whether lockdowns have a favorable or not cost-benefit balance, we have to look at the collateral effects. And I circled the ones at the bottom that I'll focus on, but I'll mention quickly that the cost-benefit analysis that I did does not consider the other factors, and that is school closures, which children missing school has effects on them into adulthood and affects their ultimate attainment of intelligence, teen pregnancy rates, illicit drug use, graduation rates, employment rates and earnings, arrest rates, and chronic diseases, and also affects children that have lost a place of food security, a place of safety, and children being physically inactive and losing their development and executive function development especially, which leads to poor decisions in the future. I talked about disrupted healthcare. There's increase in domestic violence, including intimate partner violence and child abuse. There's effects on mental health, and there will be increases in deaths of despair. There have already been increases in opioid overdose deaths and alcohol consumption and tobacco smoking, and even deaths from dementia that are not due to COVID, but due to loneliness and isolation. But in the cost-benefit analysis, I looked at the effects of the economic recession, because if the government cannot spend on the social determinants of health, then the population will experience a shortened lifespan and worse well-being. Loneliness is among the top risk factors for reduced lifespan in humans, early death, and chronic non-communicable diseases. And we have imposed loneliness on the entire population. And unemployment, which, as I don't need to tell you, has been a huge effect of the lockdowns, with over 180,000 businesses that are predicted to close across Canada, is among the top risk factors also for reduced lifespan, early death, and chronic non-communicable diseases. So when I looked at just those 3 factors, in the next slide, I framed it as what an economist, Paul Fridgers in London, England, framed it as the Corona dilemma. So if we lock down, basically we pull the lever and the COVID, the virus train is diverted, but it puts whole countries into isolation, destroying many international industries, affecting the livelihood of billions, which through reduced government services and general prosperity will cost tens of millions of lives. That's the COVID reaction or COVID response. Instead of not diverting the train and letting the virus rage unchecked. And it's important to keep in mind that we wrote unchecked there because there is a better response. So the not diverting the train, right now, this cost benefit analysis is highly biased in favor of lockdowns because we assume that there's no other response. I won't go through the exact calculations, but this is published, and you can see that the absolute minimum is that the costs on the population of lockdowns have been 10 times higher than the benefits. And that's assuming that lockdowns work to prevent COVID deaths. And that's also only considering the well-being effect of unemployment and loneliness, not the effect of them on lifespan and chronic diseases. So again, all heavily in favor of lockdowns. And even when it's done that way, lockdowns, even if they work, have a much higher cost on the population than benefit.
So the next bullet under lockdowns are based on 3 false assumptions. The third one was there was no other way to handle it. And emergency management is the way we handle every single emergency, fires, floods, tornadoes, and terrorism. But for some reason, we chose not to use it in this pandemic. Every tube that makes up our economy and our society is represented by these tubes. Now, there's many more tubes, but each of those tubes works absolutely perfectly until an emergency is experienced. When an emergency is experienced, we have emergency management organizations at each order of government that routinely coordinate across every one of those tubes. Health is but one of those tubes and is not the agency responsible for coordinating a response. At the provincial order of government, which is the order of government responsible in a pandemic, each province has an EMO, and they work with every one of those tubes on every single day. They have pre-written plans for all types of emergencies, including pandemics, which includes collaboration across all of the tubes, fully supporting the subject matter agency, which in this case would have been health. At the federal order of government, there's also an EMO, but also critical to the response.
Uh-oh, looks like we lost David Redman. You know what we'll do, since we don't have the slide presentation, I think his internet might have been just a little bit unstable. Why don't we, I know he has a couple more points to finish off, but why don't we get the other,
Sorry, I do have the presentation. They would just have to tell me where it is if you would.
You know what? We've gone on quite a bit longer than I think we expected in that first one. So I'll have a chance to get him to wrap up, but I want to make sure that we can bring in our other 2 panelists, and then we'll get into the Q&A, and we'll wait for him to dial back in. But let's, I have a good question that came in from Nicole, and thank you both so much for that presentation. I think you put this into the proper context. But I think one of the things that people are still asking is, where's the sympathy? There have been particular individuals and businesses, the entrepreneurial class in particular, that have been particularly hard hit. And yet there doesn't seem to be a sympathy factor. Everyone is so focused on trying to get those case rates down to 0, I think, that they haven't realized the consequences of it. Dr. Ari Joffe, I think, helped to articulate what some of the consequences are. But let's go next to Jocelyn Bamford with the Coalition of Concerned Manufacturers and Businesses, so that we can understand the kind of impact that these lockdowns have had on the business community, and in particular in Ontario, because I think your region has been one of the hardest hit in the country. Jocelyn, go ahead.
Yes, it has been a challenging year, to say the least. We have been the most locked down jurisdiction in North America. And faced with a whole host of things, fortunately, manufacturing was able to stay open. So our plant hasn't missed a day. We came right out of the gate, staying open. We had to completely retool how we did our business, more PPE, changing our process, buying more equipment, monitoring temperatures, completely retooled our plant in order that we can stay open. And knock wood, we have had COVID cases, but they've only been one. They have never spread to anybody else in the plant, which tells us some of the protection that we have installed worked. And we've been able to keep going. But for me, the concern is the broader business community. So how come manufacturing got to stay open, was able to retool and rejig their business to keep people protected, but other small businesses weren't? It seems to me that wasn't fair. If we could keep our business open and we've been able to manage the spread, and the manufacturing for the most part there's been some outbreaks in distribution, and there's been some outbreaks in plants, but that is the minority. The vast majority of us have been able to keep moving and keep going and keep the economy going. All of this was at the beginning, we were faced with huge costs for PPE and retooling, and we're also faced with fear. Our employees for the first month were very fearful of coming in, and for the most part, we have a very loyal and dedicated workforce, and they came in, but there was a few people that decided that CERB was a better option. So we were, even though we paid much more than CERB, people were saying, you know, if I've got some of my costs paid for, I might as well, you know, stay home and enjoy some time off. So we had that challenge. And then in addition, we had this extra cost from the federal government that, you know, it's gobsmacking to me that during a pandemic, they doubled our carbon tax. They introduced the clean fuel standards. They declared plastics as toxic. And let's face it, plastics is not toxic. If not, we wouldn't wrap our food or take our vaccines through plastic equipment. So we had all this extra cost. We had this huge fear, but we've pushed through it, and we've managed to thrive. And I feel like when I compare our employees, you know, they had purpose. They had a reason to show up. Their lives, for the most part, were the same because they got up and went to work and went home to their families. So I see that when I compare to some of my friends that haven't been out of their house in a year, I see a very different outlook. One, on the danger. I feel like the people that worked through it understood that it was serious, took it seriously, but weren't fearful. And the people that didn't leave their house were super fearful. And I don't think that's good on people's mental health. I don't think it's good as a society. There's been wars, there's been famine. What do? We push through, and we overcome, and we need to be able to do that. And we need to be able to do that with a better mental health outlook. And so our plant was able to work together in spite of all these challenges to stay open. But what we need now is we need our North American borders to be open. There's a lot of people that have multiple plants, and they need to be able to travel back and forth to keep those plants going. And if you don't have a strong private sector, for all those folks in the public sector that really didn't have their income impacted, you're not going to have a strong public sector. You're not going to have bridges, roads, and hospitals. So there needs to be an overall understanding how important private enterprise is and how important it is to keep us going so that we can have all those services that we depend upon. And then we need to push back against bad legislation. You know, Dr. Joffe and David Redman's presentation is certainly an eye-opener. And isn't it interesting that never gets out? Those numbers never get out in the media. That's not the story the media or the politicians wanted to tell. We need to get back to good science-based responses as opposed to fear and emotion responses, because those are never good. They're not good for our society, and they're not good for our kids. And then we need to push back against the federal government, the additional costs that are crippling business and having business leave. And we need, the federal government, Justin Trudeau said that this was an opportunity, COVID was an opportunity to reimagine the society. But I don't think reimagining in their vision is really where we need to go. This is a chance for us to bring back manufacturing. We saw how vulnerable we were without PPE and ventilators and equipment. We need to bring back manufacturing. We need to charge our economy through our resource sector, which can be the answer to a cleaner planet, because fossil fuels are going to continue. They're either going to buy it from us, who have very good environmental protections, or somewhere else. So we do need to step out of the fear. We need to get back to normal, and we need to have policies based on the science that Dr. Joffe and David Redman proposed, and we need to demand it. The biggest fear I have is this C10, which will prevent potentially seminars like ours going on, because we aren't subscribing to the conventional wisdom. We're challenging it, and we should be pushing back on our freedoms being restricted, whether it's freedom of speech or the freedom to run our businesses and keep our jobs going. So that's basically it in a nutshell, Danielle, and I'm open to any questions you have. And I want to thank the other panelists, because what an amazing conversation we're having.
No kidding. Thank you so much for that, Jocelyn, because I think it really does put it into perspective what the impact has been on the business community. And I'm really optimistic and hopeful that many of those businesses will be able to bounce back. But I want to jump off something that you said about how it is that we need to fight back. And I guess I'd put this to Lisa Bildy, who's been fighting back all the way through. And there's been a lot of citizens who've tried to fight back. There've been restaurant owners who tried to defy shutdown orders, and they got arrested, and the locks changed on their businesses, and their businesses confiscated. There are pastors who tried to fight back, and they got jailed, and their churches taken away from them. There are doctors who tried to fight back, and they ended up getting censored by big tech and having their videos removed, or faced discipline from the College of Physicians and Surgeons. There have been individuals who tried to organize anti-lockdown protests, and they ended up getting fined. So it seems like all the ways in which we normally fight back that used to be protected by our Charter of Rights and Freedoms, where is the charter? The courts haven't even been able to hear many of these cases because they've been shut down too. So it looks like a pretty bleak outlook. And Lisa Bildy is going to tell us why we should have some hope. I told her that she said tends to be gloomy, but we said we're going to go to her for some optimism. So first, tell us where things are at on some of those cases. Tell us why the charter hasn't worked, why the politicians haven't abided by it. How did we get to this place?
Well, all great questions. And you really just did a synopsis of my entire speech. So thank you. I can't promise a lot of optimism. I will try to come back to that flavor towards the end of what I want to say. And I will talk about some of the cases that we've done with the Justice Center over the last year and 3 months. But I always like to look at things from the zoomed out perspective, the broader societal perspective. And so if you bear with me, I just want to kind of give you some thoughts on how I see all of this in that that larger context. What happened in March of 2020 was shocking to me. I think as a factor of what China had done and what social media was conveying to the public, those were factors that led into government's hasty decisions to lock down. I'm not sure that China's behavior was entirely unintentional in letting us think that things were far more severe than they were, but that's a story for another day. In any event, it was extremely ill-advised to think that we could simply just flip a switch on an extremely complex, finely tuned society and not expect things to fall apart, especially when it's gone on for over a year, its end unfixed, and contingent on vaccine uptake, even in the provinces that are now announcing some reopening plans. And there's no promise that it will never happen again. And likewise, we can't just simply flip the switch back on and pretend it didn't happen. An incredible amount of damage has been done to our population, to our institutions, and to our liberal democracy. And that's not going to heal without a concerted effort. And frankly, given the demoralized and polarized state of our society even before COVID, it's also very possible that these exposed and heightened weaknesses in civil society could be exploited or deteriorate even further. So I want to touch on a few themes: the use of fear as a tool, the impact of coercion and censorship on our institutions, the state of the Constitution and liberal democracy, and our experiences at the Justice Center over this last year. Obviously, I'm not going to be able to do much more than skim the surface in 7 minutes. Ivan Pavlov, the Russian physiologist known for his conditioning techniques, learned that when subjects were psychologically stressed and fearful, conditioning techniques sank in very deeply and were extremely difficult to dislodge. They seem to be embedded more deeply than other forms of conditioning. So it's clear that behavioral conditioning techniques were used on the populations around the developed world. Indeed, some members of the committee responsible for imposing them in the United Kingdom, the Scientific Pandemic Influenza Group on Behavior, it was called, recently came out with comments reported in the Telegraph expressing remorse for the use of what they admit were totalitarian and unethical measures to manipulate the population into a state of fear. They admit to ramping up the threat from the pandemic to justify lockdowns. One scientist said, "The way we have used fear is dystopian. The use of fear has definitely been ethically questionable. It's been like a weird experiment. Ultimately, it backfired because people became too scared." These admissions are astounding, and there's little doubt that the same thing happened here in Canada. So let me read some more. Another member of this committee said that they were, quote, "stunned by the weaponization of behavioral psychology," and that, quote, "psychologists didn't seem to notice when it stopped being altruistic and became manipulative. They have too much power and it intoxicates them," end quote. There were concerns that the government fed the public a nonstop diet of bad news, such as deaths and hospitalizations, without ever putting those figures into context. By the way, that's the sort of information that we at the Justice Center were demanding of our governments all the way back from April of last year. And we have been continuing to track down what we can, posting it on our website, contextualizing the data as best we can, writing about it, putting it in reports and in podcasts. So please check our website, jccf.ca, if you want to find some of that data. One of the results of this fear campaign is that for about 20% or so of the population that is extremely suggestible, they're not going to snap out of this easily. Their consent to the removal of civil liberties has been induced now, and they have grown comfortable with the state of affairs. In the politically polarized climate that already existed, it has also become a virtue to be fearful, capturing even many of those who are not so suggestible. For those of us who think that the loss of civil liberties is a great threat, we're vilified and viewed as, well, pick your adjective, bad people, alt-right, white supremacists, hateful, etc. We have been conditioned to believe that our fundamental freedoms, which include our right to exercise personal responsibility for ourselves, for our families, and for our fellow citizens, are selfish or worse. Now, looking at our institutions, I don't like to mince words. I think we're past mincing words. A sanctimonious professional managerial class, largely immune to the negative impacts of lockdowns, has claimed lockdowns as a mantle of virtue, and they're not going to let it go easily. Since they dominate institutions such as the media, education, the administrative state, the legal establishment, regulatory bodies, public health, the lockdown narrative has been very difficult to dislodge. These institutions have employed coercion. We've seen it in the tyrannical overreach of regulations into the most personal aspects of our lives, fines that are unconscionable, police and public health enforcement overreach, privacy breaches, the turning of otherwise law-abiding citizens into criminals. And now we have the soft coercion of making vaccines essentially mandatory, even for those who don't personally need them. They've employed censorship, as Danielle touched on. The media has reported really only one side of the story. The College of Physicians and Surgeons of Ontario was very explicit that anybody who went against the lockdown narrative was subject to discipline. Big tech has deplatformed or put warnings on anything that goes against the narrative. And of course, the government itself, when we're talking about the federal government and its penchant for censoring, the opinions of Canadians that it doesn't like, all of this feeds into our very unhealthy situation for our institutions. And our trust in these institutions, and even in science, which has been weaponized as the science, never to be questioned, as opposed to a process by which we lead ourselves closer to the truth. All of these things are going to be very heavily damaged, and they won't recover overnight. especially as more and more people come to realize, as they sort of snap out of it, what has been perpetrated over the last 15 months. So this is not good for a functioning society. And I think we all need to work at restoring and bolstering those institutions and getting involved ourselves in those institutions to the extent we can to ensure that there is ongoing stability, because our society needs that. In the United Kingdom, a public inquiry is going to be held into the pandemic response. And we should most certainly do so here too. And some people have been calling for it. But there are a lot of people who, either don't see anything wrong with what was done over the last year, or who fear the outcome politically. So there'll have to be a lot of public pressure in order for that to come about. There does need to be some accountability, and it's simply unacceptable for governments to have spent over a year perpetuating these lockdowns and pushing us towards the vaccines as a savior, rather than admitting at the outset that they shouldn't have locked down and getting us out of it far sooner. There's been a serious crisis in leadership in this country, and including in our opposition. So briefly, liberal democracy. I mean, that's really the overarching society in which we are supposed to live. It's a remarkably fragile achievement of the Western world. It's a relative blip on the historical timeline, which has seen most of the world over most of history living under various forms of tyranny. So it's about making governments answerable to the people and not the other way around. It's about preserving fundamental individual rights from tyranny of a majority or a government. It encompasses the rule of law, which doesn't just bind the citizen. It puts constraints on government to ensure that citizens' fundamental human rights do not merely exist at the government's pleasure. The Supreme Court of Canada said in the Quebec succession reference back in 1998, at its most basic level, the rule of law vouchsafes to the citizens and residents of the country a stable, predictable, and ordered society in which to conduct their affairs. It provides a shield for individuals from arbitrary state action. Well, we have seen anything but stability over the last 15 months, changing the rules on the fly in nonsensical ways, with life-destroying fines at risk. This constantly keeps everybody on their back foot and unsettled. The Constitution is a function and an important part of a liberal democracy. It in particular, it's the law that governs the lawmakers. It's been largely disregarded by everyone over the last 15 months, from the government itself, which is supposed to be conducting its affairs and passing laws in keeping with the Constitution. It hasn't been. The executive, the administrative state, the police, the legal establishment, and the judiciary have largely marginalized the Constitution or not considered it to be particularly important right now. It is supposed to be a shield. It's supposed to safeguard that liberal democracy, especially during those times when, as the Supreme Court of Canada says, the majority will be tempted to ignore fundamental rights in order to accomplish collective goals more easily or effectively. Well, a semi-permanent state like we've had, with our emergency laws and basic rights being switched on and off by the government at will, is contrary to a constitutional order and a liberal democracy. Our courts have largely given wide berth to the governments in most cases that have come before them. They have some of them have taken judicial notice of matters of scientific debate, although they could be forgiven for thinking there is a debate, because if they watch the media every day, they probably would assume there's a consensus of opinion on most of these things. The courts need to think of their role as being a check on the government, and hopefully we will start to see some decisions on the merits where they will remember that important role. But I am concerned, because once our minds shift towards favoring this authoritarian control whenever it's necessary, we're not going to easily shift back into the mindset of freedom. Liberal democracy is like lockdowns, not something you can just turn on and off with a switch. Justice Learned Hand of the United States once said that when liberty dies in the heart of men and women, no constitution can save it. So will our governments and establishment use our fears and our willingness to hand over our freedoms against us in the future? They will if we let them. There's no shortage of causes for moral busybodies who would like very much to shape our world to their desires. Zero COVID could become zero carbon down the line. the globe's technocrats, like the Amazons and YouTubes and Google of the world, have made a fortune over the last year, and no doubt will opportunistically seize on the moment. Build back better. Okay, so that's the big picture. I'm supposed to get you to thinking about moving past the fear, though. So let me tell you one thing that you will hopefully find heartening, and that is that when we have gotten these cases into court, first of all, a number of times we've sued and the government has walked back its overreach. They just can't justify it, so they walk it back. We've had a number of cases like that where we've sued, and then within days, weeks, or weeks at the most, they have rewritten the rules, or they have changed things. Long-term care situation in Ontario was like that. Drive-in services were like that. There have been others. But when we have gotten into court, it's also been interesting how the government has not been very forthcoming with any evidence to justify its restrictions. In Alberta, we had the case of Pastor Coates. We had our evidence in a matter of weeks in January for the lockdown challenge. The government decided it needed until July. It didn't have the evidence up front, which it should have had if it's going to be imposing all these restrictions in the first place. So we got it in 6 weeks. They needed 6 months. And then they still had to delay the trial. Manitoba did not file a single bit of evidence in the hearing that we had a few weeks ago regarding outdoor transmission, but they claim that outdoor gathering limits are justified. They took a similar position on drive-in services. There's no science justifying it whatsoever. None of the provinces have presented credible evidence justifying school closures. The evidence is basically the teachers' lobby being very vociferous. And in BC, in our case out there, the government couldn't point to a single COVID case linked to an outdoor protest throughout 2020 and into 2021. But at least they had the honesty to consent to an order striking down their prohibition on outdoor protests once in court. But they still require protesters to comply with undefined safety guidelines, and tickets are still being issued by police who are pressured to go after the protesters. So the government has not provided any quantifiable cost-benefit analysis of lockdowns, despite our asking for them. They probably can't, or they fear the answer is not going to be favorable. There are many more cases to come. We're in the middle of several. We'll likely be heading to the Court of Appeal on any that we're not successful on. But even if things do reopen, and it sounds like they may start to, and we need to send a very clear message to the government that they aren't getting away with this and they dare not try it again. Thanks.
Lisa, thank you so much for that. And really the sobering thought that all of our institutions have failed us. So I want to go through and see if we can come to some consensus about what the future should look like. David, I don't know if you want to put your last slide up again, just because we lost you on your feed before you were able to finish. I'd be happy to have you do that, but let me put this to you, because you've answered this question before, and I think it's really important, is why did we let the doctors be in charge of an emergency response? Because you've been in charge of emergency response, and if you were facing your troops, would you ever say, be afraid, be very, very afraid? Would that be the tactic that you would use? Tell us a little bit about the reality of emergency response and how it is the doctors ended up failing us so badly. Oh, we've got you on mute. Oh, darn it. No, it says that you're not on mute, but we still can't hear you. Oh, I wonder if you're going to have to dial in. You know what? I'm going to put that to Dr. Ari Joffe while we're trying to figure out David's sound issue. Sometimes what happens is that when you end up dialing out, it switches over to a different microphone. So as soon as you think you've got that set, why don't you tell us? So Dr. Joffe, why don't you tell us, because I think people would default to thinking, oh yes, doctors should be in charge of a medical emergency. Do you have some compelling reasons why that wouldn't be the case?
Well, I will say that initially I thought lockdowns were the correct response. And I based that on my expertise in infectious disease and critical care. And I think so did all my colleagues that were similarly trained to me. But what I found out as I read more is that I was very wrong. And that my expertise was not suited to a pandemic response at all. It wasn't expertise of the appropriate kind. And what I mean by that is that I had blinders on. I only considered SARS coronavirus 2 and COVID-19, and that was it. And I thought that lockdowns would reduce transmission and prevent cases and deaths. But what I found out later is that my blinders, and I think in general for, as I say, other medical experts, that we missed several important facts. One is that we focus on the case fatality rate and not the infection fatality rate. That's why I tried to point out that the infection fatality rate is far lower, and that we unnecessarily were afraid. And the second point is that we missed the fact that the older population is who is at risk. People 70 years and older, especially in long-term care homes, and people 60 to 69 with multiple comorbidities. And they were the people that needed protection, not everyone else. And we locked everyone down, which didn't even protect those vulnerable people. And also, I was not trained in economics. Doctors aren't. In fact, I will tell you that the only course in university that I dropped out of ever was economics. So that will tell you how interested physicians usually are in economics. And what I didn't realize is that government debt and the recession from closing everything down can easily be predicted to cause far more loss of life and well-being than it could prevent from the virus, because the government spends on things like healthcare, roads, sanitation, vaccines, social security nets, and many other things that determine population well-being and population lifespan. And the other thing that I hadn't considered is all the collateral damage that would occur that we went through in the talk. So I found out that medical expertise is necessary in addressing a pandemic, but it's far from sufficient. And emergency management experts, I learned from David Redman, would have considered all of those factors and made much better, in my view, decisions. So I think it's, so yes, doctors, I think, should not have been put in charge because we don't have the appropriate expertise. At least that's my opinion. And I think that was a major flaw in the response. And I know the last thing that I'll mention, I know I'm going on too long, but inducing fear is the completely wrong way to manage a population when we're facing a potential crisis. And many articles I've read about communications in a crisis, and also talking with David Redman, have taught me that that was the exact opposite of what should have been done. But that's the gut reaction of how physicians try to get people to comply with their recommendations, or at least that's in my opinion. So yeah, I think that was a big mistake.
Thank you so much for that, Dr. Joffe. I hope we've got David Redman's.
I hope so too.
Oh my goodness, thank heavens. I'm glad
I just
you're back.
rebooted everything.
Thank you for being back. But can you jump off of that? Because I think there really is a couple of important things that Dr. Joffe said. One is that the tunnel vision that the doctors, the chief medical officers got into, and the other was the demeanor and the limitation in how they were looking at the issue. How would that be different for somebody who is heading and is trained in emergency response? How would the approach have been different?
Completely. So let me just go back to the concept that for every type of emergency in Canada, we have pre-written plans. And for every one of those plans, there's what's called a subject matter expert. For a pandemic itself, for a wildfire, it's the Wildfire Operations Center. In every province in Canada, everyone watching this, you all know what happens when a wildfire happens. Your wildfire operations people come in and go for it. But immediately behind them, the subject matter expert is responsible to deal specifically with the hazard. The emergency management organization stands right beside them and right behind them and brings everything else to bear. The people that evacuate a community like Fort McMurray when the wildfire was about to blow right through it wasn't the Wildfire Operations Center. Their job is to fight that fire. The municipality, the EMO, set up the reception centers in Edmonton, set up the reception centers down the road, ran all the road networks with Alberta Transportation. They brought every government department to save the people of Fort McMurray from that fire. That's exactly how you handle every emergency. The coordinating agency is always the same. It's the EMO. And they link across all the government departments, across the entire private sector, across the NGOs, pull the information for citizens, push the information for citizens, and do that for every single type of emergency: fire, flood, tornado, terrorism, pandemic. For some reason, at the start of this pandemic, and I think Lisa hit part of it, we watched all the news reports coming out of China. We saw the terror in Italy and Spain, and the premiers, instead of going to the briefing book that every one of them had that said, when in an emergency, call your EMO, they went medical, call health. That first mistake tumbled, and once you're into it, hubris says you don't get out of it. Your comment, and Ari's comments about fear. I've been some pretty horrible places in my life in my first 27 years in the Army. The first thing you learn, whether you're a lieutenant, a captain, a major, a colonel, a general, you never, ever use the word fear. You always use the word confidence. And our premiers from the word go had the choice to use the word confidence. I wrote them a paper on it back in April to say how to not use fear in this pandemic because it has unintended consequences. The whole point about fear is once unleashed, it is 10 times harder to pull it back. And that's where we are now. And that's why I say in the presentation and why I say in all my papers, it's going to take a dedicated 30-day plan to remove the fear.
Thank you so much for that. I know we're going over, but I want to give everyone another chance to go around and just comment on this aspect of fear and really drive the point home that David Redman won't be surprised. He's convinced me long ago that the wrong people were in charge. But Jocelyn, let me put that to you, because in some ways, I honestly feel like it's been the Premier of Ontario, Doug Ford, who's been driving the fear bus. And he's even said, no one would ever go against their medical officer of health. They'd be a lunatic to, or it would be deadly to them from a political point of view. Can you comment on his tone, his demeanor, and why he abdicated responsibility as a politician? That's the thing that I'm still sort of struggling to understand, because we haven't seen that in the United States. We've seen that the chief executive have been taking the power back and making the decisions. What went so wrong in Ontario? Because it's so important in setting the tone for the country.
Well, I think that when you look in Ontario, there's a couple of factors. We really see the power of the public sector unions, because the teachers union was huge on if we keep the schools open, the kids are going to kill grandma. The Nurses Association was huge. We saw ads all over the place from those public sector unions. So we really see the drive and push from the public sector unions. And then if you look at mainstream media, there was a very outspoken doctor, an ER doctor at Michael Garron Hospital, that was basically saying the Premier's killing all these people. And that one doctor was picked up by almost every media outlet as the guru of how we should handle the pandemic. And they were pushing for hard lockdown. So there was no emergency management. There was no look at the hard facts. It was all fear and emotion. It wasn't driven by science or intellect or a good plan. It was driven by emotion and fear, media, unions, and it was awful. That should never, ever happen again in Ontario or Canada, because that's just going to destroy our democracy. It's going to destroy our society. It's going to destroy our economy. And that's really how I think we ended up being the most locked down province. And I don't know why anyone would advocate leadership to the medical community, because as Dr. Redman said, that's a microcosm, but it does highlight one of the issues we have in the Canadian medical institutions, and that is that we can never have a conversation about a public-private partnership in healthcare. And if you look at just the statistics of where in a normal flu season our capacity is at, a pandemic pushes that way over the edge. So we in Canada need to have that conversation. There are many jurisdictions that marry public and private and take off capacity off the public healthcare system. But if you have that conversation, you're not a Canadian, you're a heretic, you're an alt-right. I'm sure that now they're going to add in you're racist, whatever, because that's how they roll. But we need to push back and have that conversation, because we'll never be able to plan for the next pandemic. And I'm sure Dr. Joffe can, and Dr. Redman can contest that this is probably not the last pandemic we're ever going to see, and it's probably not the worst pandemic we ever see. So if we don't learn now how to control our capacity and control how we handle it, we're going to be in a really bad space for our kids.
All right. I don't know if Lieutenant Colonel Redman wants me to correct his title, since we're giving the doctors a pretty hard time, or if maybe you got your PhD in the meantime since I've last spoken with you. But I think when you're referencing some of the comments that were being made, I think you—
Sorry, only a master's in engineering.
There you go. There you go. You have it. Let me maybe finish off, because we're getting near the end of our time here with Lisa Bildy and some of the comments you were making about our institutions failing us, because this once again is the real danger of having doctors in charge, is it seems like no one can question them. Big tech didn't allow other doctors to question them. The College of Physicians and Surgeons wouldn't let the chief medical officer be questioned. Even when MLA stepped up to question the Dr. Dina Hinshaw in Alberta, it was seen to be shattering the confidence in our public health officials and the public health messages. Isn't that something that the courts are supposed to cut through? Aren't the courts supposed to be that sober second thought? How is it that chief medical officers have been able to duck accountability? In BC, Dr. Bonnie Henry not justifying why she shut down churches. In Alberta, why it is that Dr. Dina Hinshaw hasn't been held to account for some of the lockdown measures that she's had. That, I guess, is the other real problem of letting doctors be in charge, is nobody wants to challenge them. And so there's never any accountability for when they get things wrong. How did our court system fail us on that, Lisa?
Well, some of the things that have been heard so far have been injunctions and judicial reviews. So they haven't been full-blown charter challenges. We've got one that was just heard in Manitoba recently, and it did get into the science. And we had Dr. Bhattacharya as one of our expert witnesses. We had a couple of excellent witnesses, actually, and that's still on reserve. We haven't heard how the judge is going to handle that, but that was a full-throated, hearing of the issues. In BC, because it was a judicial review, the question really was, did Dr. Henry, was she working within the realm of reasonable decisions? It wasn't really an analysis of whether it was a correct decision. It was just whether it was reasonable. And so, it doesn't really hold her to account, but in the way that we would all like to see. But it was appropriate to, I guess, to that kind of analysis was appropriate to the form in which it occurred. Now it's being appealed, I believe, so that there'll be a higher court weighing in on some of the legal issues there. It takes time. It takes time too to work through the judicial system. I mean, it was closed for many months. We had to prove urgency in order to even get into court on constitutional challenges. The government, when it wants to bring an enforcement measure or get an injunction against an entire province, as has happened in Alberta and in Nova Scotia now, they can get into court immediately. But if you're trying to bring a constitutional challenge, of course, you've got to build your case, but also, you're in the queue. So, it's not finished yet. These cases will be going on for some months, and hopefully there will be accountability. In the moment, though, when we're all trying to deal with it, it's very hard in an urgent sort of way to get that accountability. It falls on our politicians to do their job, to listen to the voices of the public health officials, but not let them be the leaders. And many of our politicians failed on that count.
All right. Before I hand it back to Troy, I want to try to do a quick round robin. I know it's hard to with this panel because you've got so many great insights and so many things to say. But Lisa, we've begun to see the end of the line here in Alberta. I started off there saying, hey, all the restrictions are going to be gone by June. Is it over when that happens? Or do you fear that we'll go back into this kind of approach in the fall?
Well, I'm already seeing news reports just in the last day or two about some, potentially terrible fourth wave thing, some massive variant, multiple variant, I don't know what they'll come up with. But I mean, if people are still primed for fear, and they may be, as I said, it's going to take a little while to get through that mindset. There may be still pressure in the fall. I think there will be, to be perfectly honest. I don't think we're done with this. And that's why I think we really need to get ourselves in a place where the government simply cannot do this again. Like it's got to be taken away from them, the power to do this again.
Jocelyn, what's your thought? I mean, you've got employees, you've got customers. Do you feel like there's enough will to move past this, or are you worried about what happens in the fall that we're going to see a redo?
Yeah, I'm worried what's going to happen in the fall and the next outbreak. And I'm also worried because there's been no discussion on the difference between different business sectors. So they decided that manufacturing gets to stay open because, let's face it, if the supply chain falls apart, everything falls apart, from the hospitals not getting their medicines and their food, but also the small entrepreneurs that have one or two employees and they run a dress shop. There's no reason that they couldn't, with proper precautions, stay open through this pandemic. And no one's really answering the question as to the rhyme or reason for different shutdowns, for different, smaller, non-essential businesses. And I think, again, for us to be prepared for the next time, we really have to answer and ask and have answered those hard questions because they weren't based on science.
All right. Let's go to Dr. Joffe. Do you think the medical community has realized their hubris, that maybe they overstepped and maybe they should dial it back and put it in charge of the medical or of the emergency management next time around? Or do you think that they're going to reassert themselves next time a new virus or a new variant comes up? I think, go ahead.
Yes, I am on. You know what, that's a difficult question, but if I answer completely honestly, I think the answer is no, that the medical so-called experts feel they have managed this well and will reassert again in the future. So that's why we need to make sure an emergency management agency is in charge next time.
All right, I'll put it to David Redman. How do we ensure that happens next time? Because, and I will get your thoughts on that too. Are you worried of a redo in the fall, or are your sort of colleagues in the emergency management profession, are they going to, maybe you guys need to have a conference and say, whoa, we could have done this completely different. How do we make sure this doesn't happen again?
Okay, first of all, we can't do it any differently until we remove the fear. That has to be step one. And in my opinion, the only way now to remove the fear is to prove that the use of the non-pharmaceutical interventions in the manner that we did for this virus was criminally wrong. And so we need people like Lisa, but we need people that will bring class action lawsuits to hold criminally liable for all the collateral deaths and damage that have been caused by lockdowns. I've written a paper a position paper on constitutional charter rights. I'm now writing one on the criminal liability aspect. And it's got to be done. It's a terrible thing to say, but we have to hold premiers and MOH criminally liable for what they've done. If we don't, this will happen again in November. It'll probably happen, I would say, by 15th of October. That's when the seasonal flu virus goes up. So if we don't take the step to actually hold people accountable and say lockdowns were wrong, we will simply use them every time in the future. And the reason emergency managers having a conference is useless is because the premiers are in charge and they will do the same thing again.
All right, that's a bit of a bleak outlook. I was hoping for us to end on a more positive note, but I think we've got perhaps the seeds of another update as we get through the summer and into the fall. I'll hand it back to Troy Lanigan. You heard today from Dr. Ari Joffe, from David Redman, from Jocelyn Bamford, and from Lisa Bildy.
Thank you, Danielle, and to all our panelists for an excellent discussion that could have gone on much longer. I was watching the Q&A. I think, Zoe, we can get the slides out to everybody that registered for this event and spread that information far and wide as part of shedding light on this. Again, this exchange call, for those of you also that asked in the Q&A, will be posted on our website and our YouTube page tomorrow morning. The result of our poll today, 77% said, let's do it later in the evening, but then I asked people who were on it later in the evening. So maybe we'll have to ask the question at the earlier time the next time we do this. Again, anyone interested in receiving a complimentary ebook, Life After COVID, What's Next for Canada, can do so by going to secondstreet.org. We'll be back next week as we tackle the subject, big government, free speech, and tinfoil hats, a discussion on Bill C-10, which also came up in the discussion today, importantly. Registration is available on the Canada Strong and Free Network website. Again, thank you to our sponsor today, the Modern Miracle Network. We are the Canada Strong and Free Network. If you appreciate and value the work that we are doing, please consider a donation. Thank you to everyone for joining us. We'll see you again next Wednesday.